Hey, hi, Misty. My name is Julie. I'm going to be your nurse today, and I'm going to do your assessments. As you were walking in, I took a general survey, assessed your general appearance, your gait, and your balance, and your mood, your affect. Everything seems to be normal today. Um, while you're here, I'm going to go ahead and I'm going to assess your height and weight. So if you could just go ahead and step up here on the scale. Okay, 147. Very good. I'm going to check your height. It's like 5'7". And then I'm going to check your weight circumference. I want to measure here at the navel. Okay, about 32.5. And then while you're standing, I'm going to go ahead and have you, we're here at the 20-foot mark. I'm going to go ahead and do the Schnellen eye chart exam. I'm going to walk down here and then I'll give you instructions. Okay, if you could lightly cover your left eye and read the very smallest line that you can read.
DEFPOTEZ.
Okay, and lightly cover your other eye and read the smallest line.
DEFPOTEZ.
Very good. And then with both eyes, read the smallest line that you can read.
LEFODPCT.
That's very good. It's 20/20 vision. Are you wearing any glasses or contacts?
Contacts.
Okay. Looks like that's a good prescription. Okay, and while you're standing here, if it's okay with you, I'd like to go ahead and do a full skin assessment from head to toe. Okay, and I did notice in your health history that you had some moles removed a few years ago that were suspicious, so I'm going to just be really thorough looking for moles and looking for any other redness or rashes or lesions, bruises, anything abnormal. Kind of raise your arms for me. Very good. Have you noticed any wounds or any sore spots on your skin? Okay. All right, and if you could lift your breast for me, please. Thank you. Okay, you can go ahead and have a seat. Okay. And as I was going through your health history, I noticed you were taking a multivitamin every day. That's very good. Is there any other medications you take on a regular basis?
No.
All right. Very good. Now I'm just going to assess your vital signs. What does your blood pressure usually run you?
110/70.
Okay, very good. That's a good fit for you right there. Just make it a little tight. I'm going to pump it up to about 175. Okay, very good. It's 108/68. Okay, and I'm also going to go ahead and assess your radial pulse. And after a full minute, your pulse is 72 and your respirations are 18, which are both within normal limits. I'm going to go ahead and I'm going to check your oral temperature. I'm going to put this at the back of your tongue there. Go ahead and close your mouth. Okay, and that's 98.4, which is great. And I'm going to check your oxygen saturation. And that is 100%, which is excellent. And now I'm going to start with the head-to-toe assessment. If at any time you're uncomfortable or you're having any pain, you just let me know, okay? All right, let me wash my hands real quick. All right, I'm going to start with your scalp. I'm just assessing for any lesions, any old trauma. I'm checking for hygiene. Very good. Any sore spots?
No.
Okay, very good. I'm gonna check your sinuses, facial sinuses. I'm gonna check your maxillary sinuses. Any discomfort with that? Okay, very good. Now we assess cranial nerve number 2 with the Snellen eye chart. Now I'm gonna go through the rest of the cranial nerves. The next ones, 3, 4, and 5, I'll be checking your eyes. First I'm gonna check your pupil. Very good. Okay, both your pupils are equal and reactive to light. And then I'm going to go ahead and check for a red reflex, so I want you to go ahead and just look straight ahead. Very good. Very good. Okay, and then I'm going to have you follow my finger. Just checking for nystagmus. Very good. And I'm going to check for convergence. Very good. Okay, and then I'm going to check cranial nerves number 5. And this, I'll have something sharp, not too sharp, and then something soft. I'll have you close your eyes and then tell me what you're feeling, okay?
Sharp. Soft. Sharp. Soft.
Very good. And then while I have this, I'm just going to touch different parts of your body with this, and you just let me know when you're feeling it.
Sharp. 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 Sharp.
Very good. Also want you to clench your teeth. Very good. I'm going to assess cranial nerve number 7, so I'd like you to puff out your cheeks for me. Smile. Show your teeth. Squint your eyes. Very good. And then cranial nerve number 8, I want you to close your eyes, and then I want you to tell me when you hear something, okay? Okay, and then I'm going to whisper something in your ear, and I just want you to repeat what you're hearing.
17. 24.
That's very good. And then I'm also going to assess cranial nerves number 9, 10, and 12. And by that, I will be looking into your mouth. Okay, first I just want to have you open your mouth, and I'm going to inspect. All your oral mucosa is nice and pink and moist. I don't see any sores. I don't see any tooth decay. I'd like you to say ah. See that your uvula is going up. That's excellent. I'm going to assess for a gag reflex. Positive. That's good. I'd like you to stick out your tongue and move it from side to side. It's very good. You can go ahead and close your mouth. And then, could you tell me your address, please?
10913 West Havenhurst.
Okay, I'm just assessing your voice for any hoarseness or anything irregular. And then I will check very quickly cranial nerve number 11. That's your trapezius muscle. First, I want to just inspect it. I'll have you shrug your shoulders up against me. Very good. It's good strength. And then I'm going to put my hand on the side of your face, and I want you to push against my hand. Very good. Very good. Okay. Now I'm going to inspect your ears. Okay. Pull the pinna back. Okay, just a little bit of wax, which is normal. And then I see the light reflecting on your tympanic membrane, which is a pearly gray, which is totally normal. And the same in this one. I don't see any redness or drainage in either ears. No signs of irritation.